My name is Dr. Bharat Kumar Reddy, Consultant Psychiatrist, Apollo Hospital, Hyderabad. Today I would like to talk about a very important topic, that is Alzheimer's dementia. A lot of people might have been hearing this illness or hearing about this of late. Unfortunately, this is an illness that affects our elderly individuals or our elderly population. As people are living older and life expectancy has gone up in our country, slowly we are facing this Alzheimer's dementia. Previously, 20 years ago, Alzheimer's dementia was an illness for the Western world, where people used to live till 80 years, 90 years, and used to see them having and suffering with Alzheimer's dementia. Now, since life expectancy in India has also gone up, now individuals since are living till age of 70, 75 and 80 plus, we are seeing this Alzheimer's dementia increasing in our country also. As age increases, the chances of you developing Alzheimer's dementia also increases. Now, what is the paramount symptom to identify Alzheimer's dementia is forgetfulness. Yes, you might ask me, all elderly will have this symptom because once you get old, you start forgetting. Then how would you say whether it's Alzheimer's dementia or normal senile forgetfulness? Yes, it's a very important question to answer. A normal senile forgetfulness, individual has the capacity to recall once he is given any hints or symptoms. For example, somebody comes to your house and your granddad struggles to identify him or struggles to find his name. But once you give a hint like he is your neighbor's son or he is your uncle's son or something, he quickly recollects it. But individual with Alzheimer's dementia would struggle to recollect despite giving enough hints because their recall is impaired. Their recalling capacity, the memory recalling capacity is impaired. Henceforth, they struggle to identify or recall what it is. You will always see them suffering with a lot of symptoms suggestive of problems in their immediate memory. For example, if after a few hours you ask them what they had for breakfast, they will not be able to recollect. Many times they will eat and then come back again asking for food because they have forgotten that they have already had their food. So these kind of small symptoms in their immediate memory, you should be warned that you have to identify whether he or she is developing Alzheimer's dementia, especially in elderly individuals. Apart from that, as the illness progresses, you will also start noticing a lot of behavioral symptoms in them. They will become very emotionally labile. They will have mood swings. They don't say or do things consistently. Their sleep pattern gets altered. Their eating habits get altered. Their physical state starts taking a hit. They stay indoors. They stay in bed most of the time. They start deteriorating gradually, both physically and mentally. Their memory starts getting worse. They just can't recollect anything in immediate and recent memories, but their remote memory would be preserved. For example, if you ask what has happened 30 or 40 years ago, they may be able to recall it, but what has happened today or yesterday, it is not there. So all these symptoms are suggestive of Alzheimer's dementia. Now, unfortunately, as science stands today, we are not in a state to say that we can cure Alzheimer's dementia. Yes, we have medicines to control it, but cannot cure it. This is an unfortunate thing as of now. Who knows what kind of advances we are going to make in future, and an illness like Alzheimer's disease can also be cured. But as science stands now, it is only controllable, not curable. But the biggest important take-home message is you have to identify the illness at the early stage, get them onto treatment very quickly so that the memory doesn't deteriorate further, so that the other symptoms are delayed. But once the illness starts progressing, it goes through mild, moderate and severe stages. Once the individual reaches into severe stage, they will be bedridden, they will be doubly incontinent. That means they will not know, they do not have control on their bladder, they will not have control on their bowel, and they will become doubly incontinent, bedridden, and terminally ill. So we have to prevent that stage as far as possible. In order to do that, we have to get them onto medicines, get them onto treatment at very early stage. So elderly individuals at home, please look out for these symptoms to make sure that you identify Alzheimer's disease. This is not something which is left or something which was confined to Western world. Now it is happening in our country also, and every year the prevalence and incidence of Alzheimer's disease is increasing. Every year, lot of elderly individuals are being diagnosed with Alzheimer's disease, and unfortunately, our social makeup and social network doesn't have the resources to take care of them. So it is important from family's point of view that they have to put that extra effort to look after them, because once Alzheimer's disease starts in an individual, they almost become like children. So it is like they are grown-up children. They have to be taken care, they have to be fed, they have to be taken for bath, they have to be looked after for everyday life events, everyday day-to-day activities. So it is like looking after grown-up children. So we expect the families to accept that responsibility and take care of elderly once they develop Alzheimer's dementia. And we are also having a lot of self-help groups who would help families who are having Alzheimer's disease, dementia patients with them, in supporting them and then advising them. And we also have carers group for people who are the carers of Alzheimer's disease patients to come together on a common platform to share their feelings, emotions, problems. And that group also helps carers to gain that extra strength and balance to take care of their elderly when they become sick. So my efforts from my point of view as a psychiatrist is, if elderly individual starts expressing odd behavior, start showing odd characters, don't neglect it as it's part of aging. Please get him to a psychiatrist for a proper thorough assessment so that we identify whether the individual is suffering from Alzheimer's disease. If so, get him onto treatment as early as possible and create a structure, a supportive network for him and also for his family. Please look out for symptoms of forgetfulness in the elderly. If they have it, don't neglect it. Please bring them to a professional to rule out Alzheimer's disease. If the professional sees them and says it's just part of normal aging, then you don't need to worry. But if it is Alzheimer's disease, then it becomes even more paramount to get help as early as possible. So don't neglect Alzheimer's disease. Please look out for it in the elderly, in your neighbors, in your parents, your grandparents. And if you identify it, please get him to a professional for a proper treatment and assessment.